Okay, good morning, students. Am I audible?
Yes, ma'am. Good morning,
Morning,
ma'am.
ma'am.
Good morning. Okay, I will take your PSM practical. Ami, I guess we were discussing on infection, right? Infection. Till where did we complete? Bacteria or virus hole ne? PSM practicals. Topic to asile infection. Hoy ne, Hamida?
Yes, ma'am. Infection and disinfection.
নহয় PSM practicals or infection তাতে মানে infection is the invasion and multiplication of microorganisms এইবোৰ আছিলে ন bacteria virus
Yes, ma'am.
parasites
Yes, ma'am.
তো virus টো হ'ল নে আমাৰ
ভাইৰাছ টো লোকে লিখাই দিলে টু ভাইৰাছ লিখিছিলে নম্বৰটো
আৰু
ইনফেকচনৰ
example corona virus এইটো আছিলে ন
তালৈকে
Hi,
লিখালে
ma'am. Coronavirus.
example corona virus বুলি দিছিলো যে এইটো ন
Yes,
তালৈকে
ma'am.
লিখালে
আচ্ছা parasites টো হ'ল নে parasites
নাই
ঠিক আছে 3 নম্বৰটো লিখা parasites PARASITES first to asle tumar bacteria second to asle viruses and third number likha parasites number 3 you write down parasites 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 and put a dash and write down it is an organism it is an organism ORGANISM it is an organism that lives LIVS it is an organism that lives lives on or on or in a host organism and get its food FWOD and get its food from the host body So parasites to ki hoy parasites it will live inside our body it is inside our body okay and it used to feed from the host body jodi in cows hookworm okay tapeworm jodi thake it will be inside the body of the host and it will feed from the host body okay that is known as parasites full stop examples likha hookworm examples hookworm 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 comma head lice head 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 lice LIC lice head lice etc etc
Hat lice, ma'am. AHADE.
head HEAD moor HEAD head lice LIC head lice
Okay, ma'am.
In your hair there used to be pook, no? Hygiene maintain no korile sulit pook thake je, that is known as head lice.
Okay, ma'am.
Source of infection, itu likisa na? Source of infection itu?
Ma'am, aha nai.
এতিয়া
নাই ma'am. আহিছে লিখা নাই ma'am.
আচ্ছা
নাই।
ঠিক আছে itu লিখা source of infection দুটা sources আছে endogenous মানে direct source আৰু exogenous মানে indirect source তো প্ৰথমে লিখি লোৱা endogenous মানে কি endogenous means first you write down endogenous caused by the organisms that are present as part of normal flora of the patient. So endogenous means it is already caused in by the organisms that are present within the host body, that is within the patient. Okay, within the person itself, that is known as endogenous. Exogenous means external force. External money maybe through hospital environment you can get different kinds of organisms like in the form of air, okay, in the form of dust, IV fluids and catheters. IV fluids are IV fluids mane tumar saline bottles, okay, in hospital saline bottles thake, so saline bottles mane intravenous fluids. IV mane intravenous fluids and catheters. tar pisot wash bowls, bed pans mane, do you know what is bed pen? Bed pen, গম পোৱা নে? Do you know bed pen?
Na ma'am.
Bed pen tate mane potty urine এইবোৰ কৰিব পাৰে যে বেডৰ তলত ৰাখি দিয়ে ন হস্পিটেলত in hospital. Have you seen? Raba, I will show you one picture. Wait. Wait for 1 minute. Achha, are you able to see the screen?
Yes, ma'am.
Can you see this?
Yes, ma'am.
Itu
Yes, ma'am.
Yat mane potty peshab ebur kore no in hospitals after surgery, after operation. Okay, all those patients they used to pass their urine and stool here. This is known as bed pen. Okay, itu hoy bed pen. You got it?
Yes, ma'am.
Okay, have you seen before? Agote dekhis na ne?
No, ma'am.
তাৰপিছত Are you able to see the screen?
Yes, ma'am.
So second next point after bed pen to ki asle tumar endoscopy. Hoy na? So endoscopy at a procedure hoy, okay, that through which the digestive system can be examined. Okay, for kidney stone, okay, petor bitor jodi kiba big jodi like if there is any kind of parasites or anything, it can be detected through endoscopy. Okay, it is used for determining the digestive system. Endoscopy is a procedure. ঠিক আছে? This is a pipe through which the doctor will be able to examine, and this pipe it will go through the nose. Nakhodi humai pura to the digestive system. It will go inside the esophagus, stomach, and lastly the duodenum here till the stomach. Okay, from nakhodi pura till the stomach, the endoscopy tube will be there inside, through which the doctor will be able to examine any kind of parasite or virus or bacteria or disease, okay, kidney stone, anything. It can be detected through endoscopy. Okay. Next, tomorrow. Ventilators and respiratory equipments. Oh, wait. Okay, next point কি আসলে তোমার? Ventilation and respiratory equipment. Are you able to see the screen?
Yes, ma'am.
So this is a ventilator and lung monitoring system. Okay, here the patient will be given artificial breathing. Okay, it is an artificial breathing through which the patient, if the patient is on coma, okay, if the patient is very ill, okay, if the patient is suffering from meningitis, head injury, trauma, then the patient will have to be admitted in the ICU. Okay, and there this monitors will have to be checked regularly. Or yat mane tumar vital signs, ebur vital signs as a temperature, pulse, respiration sob dekha pa. Okay, everything will be there on the monitor. Temperature, pulse, patient or temperature kiman, pulse kiman, respiratory rate kiman. Okay, patient or mane the heartbeat, and everything will be there on the screen. And through this, it is known as ventilator. Okay, it is also known as artificial respiration. It artificial respiration through which the patient will be able to breathe. Okay, so this is known as ventilator and respiratory equipment. Okay, so yeah, you can write. Are you able to see the screen?
Yes, ma'am. Aku gol.
Yeah,
আহিছে।
ঠিক আছে, এইটো লিখা। Endogenous mane internal, internally or directly. Exogenous mane indirect aru from outside. From outside, how can we get infection? Okay, so it will be especially all those people who used to work in hospitals, okay, hospital environment, mostly they used to suffer from exogenous infection because they are always contaminated with all those patients. They always deal with the patient. Okay, they used to they need to check, okay, for all these objects that are present: endoscopy or bedpan or wash bowl, ventilators, water disinfectants, anything. So all those people who used to work in hospital, they mostly used to get infected. Okay, so you need to wash your hands properly, hand washing bhalke koribo lagibo. Then you need to wear mask, gloves, ebor pinibo lage. Okay, all those people who are working in hospital setting. because different people used to get admitted in the hospital. Kisumanor bahut dangor diseases thake, kisumanor horu. So we do not know what the patient is suffering. Jodi patient TB, jodi tuberculosis, TB suffer kori asnale holeo mane it is very much risky for the health personnel. Okay, because TB and all, it can be spread from one person to another. So he karone we should always maintain ourselves when we are working in a hospital. We should be very much careful.
মেম গোটেইখিনি লিখিম নেকি?
দুটা এনেকুৱা কি টেবল বনোৱা আৰু তাৰ পিছত এটা সাইডত এন্ডোজেনাস এটা সাইডত এক্সোজেনাস।
মেম এটা ইউনিট বেলেগ নেকি?
নহয় এইটো PSM প্ৰেক্টিকেলছৰ ইনফেকশন আছিলে ন টপিক। এইটো কন্টিনিউয়েশন অফ ইনফেকশন হয়। Hall ne finish?
Yes, ma'am. Hall.
Hall?
Yes, ma'am.
আচ্ছা
I see.
তাৰপিছত Okay, are you able to see the screen? Ito?
No, ma'am.
Itia?
I see, ma'am.
Acha, ito bono.
I see.
Diagram to bono. Appetite loss, nutrient loss, malabsorption, altered metabolism hole, what will happen? It will lead to malnutrition. Malnutrition hole, lowered immunity, tumor immunity level down, it will go down. Then there will be epithelial barrier damage. Epithelial means in your skin there will be some kind of damage. Then there will be weight loss. Then there will be growth faltering. Growth faltering means your growth level will decrease, okay, or it will be deceased. Next, it will ultimately lead to infection. So nutrition and infection cycle is also equally important. Nutrition, okay, whenever you are healthy, okay, whenever your nutrition is good, appetite is good, then you can keep yourself away from various kinds of infection. Aro immunity, okay, good immunity, you should take immunization like polio. Have you taken polio when you were small? Polio vaccine?
Hi, so ma'am.
Yes, ma'am.
Why you need to take polio? Polio, TT, এবোৰ কিয় ল'ব লাগে? Hepatitis B.
To resist polio virus. To resist polio virus.
Huh?
To resist polio virus.
Yes. Because this polio is also known as poliomyelitis, right? Poliomyelitis. So this poliomyelitis is very much dangerous. Okay, if you don't take the polio vaccines, then it might lead to poliomyelitis, which can lead to paralysis of the body. You should be well immunized. So this is just a simple at a diagram. Okay, it's not so much important into any like just for your knowledge I have given, but iman important nahoy itu. But you should know. In our next class, we will discuss about immunization. Okay, immunization schedule. Have you finished? Whole na?
Yes, ma'am.
So in short, this is all about your infection. Our infection tomorrow heri PSM theory tateo ase no infection and disinfection. To whatever notes you have written for PSM practical, it is same notes too you can study for PSM theory also. Okay, moi belek ke need to notes to me poriba paribo. Okay, same notes. Basically aru beki hoi jabo. Already বহুত khini ase PSM aru FA. ঠিক আছে মোৰ ক্লাস কেতিয়া আছে আৰু এটাত আছে ন FA থিওৰি নেকি
মেম লাষ্টৰ ডায়াগ্ৰামটো অকমান দেখাই দিয়কচোন অকমান থাকি গ'ল লাষ্টৰ দেখো
আহিছে নে
আহিছে মেম হৈ গ'ল মেম হ'ব হৈ গ'ল লাষ্টৰ অকমান ঠাই
ঠিক আছে মোক I will take your হেৰি attendance Sahil Rahman roll number
present ma'am 90
huh
ma'am roll number 90
90
yes ma'am
Anju 114 Abhinash Keshav
Present ma'am 148.
148 Amrit
140 ma'am
140 Ankur Ankur absent Barnali
Yes, ma'am.
roll number
87.
Bhanita
Yes, ma'am.
roll number
Ma'am, 116.
116 Vidyut huh? What is your roll number? Bitupan
Yes, ma'am.
roll number
154, ma'am.
154 Chichim roll number what is your roll number Hamida
Yes, ma'am. 100, ma'am.
100 Harita sir Harita sir
Oh yes ma'am 109
109 Himashri
Yes, ma'am.
roll number
Ma'am, 99.
99 Rishikesh
Yes, ma'am. 84.
84 Yogita.
Yes, ma'am.
Yogita Sonowal. Roll number?
162.
162. Kilisha.
Yes, ma'am.
Roll number?
119.
119. Koilash.
Yes, ma'am.
Roll number?
157.
157. Lakshya Deka.
143, ma'am.
143. তাৰপিছত Madhumita.
Yes, ma'am. 161.
161. Maharshi.
145.
145. Niku. Niku.
Yes, ma'am.
Roll number?
146.
146. Nobojit.
Yes, ma'am.
Roll number?
151.
151. Ripen.
Yes, ma'am.
Roll number? Hmm? Huh?
97, ma'am.
97.
7, ma'am.
Huh? 97.
Yes.
Porankuti.
Hello.
Present, ma'am.
Roll number?
112.
112. Porishmita Deka.
Ma'am, triple one.
1. Preeti. Preeti Shangshai.
Yes, ma'am. 136.
136. Preeti Shmita.
Yes, ma'am.
Roll number?
144. 144.
144. Rejum. Rejum Rombi. What?
132, ma'am.
132.
132.
Okay. Rokibul Mondal.
Ma'am, 139.
139. Rubul. Rubul Amin.
Yes, ma'am. 123.
123. Rukia.
Yes, ma'am.
Roll number?
138.
138. Samudra.
147, ma'am.
147. Saurav. Saurav. Saurav, জলদি কোৱা। Sishang.
আমি এত বেশি করলাম কি?
Sishang.
ফার্স্টে দেখে লং আছে।
Sishang. জলদি কোৱা।
29.
Huh?
129.
170.
তারপর নিলাম 10,000। হ্যাঁ।
129.
Smriti.
10,000 কমে গেল।
Smriti.
কাপড়ে এখানে কত গেল? 4,000।
Roki Mondal.
133.
1. Huh? Smriti Rekha Roy.
Yes, ma'am. 133.
133. Snigdha.
Yes, ma'am. 158.
Huh? 198.
158.
158. তাৰপিছত Sujata. Sujata Dole.
Ma'am, 82.
82. তাৰপিছত Shushmita Das.
118.
Pinaya. Pinayana.
Yes, ma'am. Yes, ma'am. 165.
160. Veronica.
Yes, ma'am.
Hello.
101, ma'am.
101. আৰু এইটো কি হয় এইটো এক্সেল ব্ৰো না কি roll number
Ma'am, Kushal Bora.
roll number
Ma'am, 117.
117 ঠিক আছে anybody missed out
Ma'am, no.
Rohul Amin
Hello, ma'am.
Yes, ma'am.
Rohul Amin roll number
91.
91 Aru anyone left out
Ma'am, Sisanga 129.
hold huh
Ma'am, 131.
131 okay anybody else hold no
Ma'am.
hmm?
Ma'am, 152, ma'am.
huh Vidyut ঠিক আছে anybody else
152.
132 ঠিক আছে okay ঠিক আছে thank you
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am.
Hmm,
Have a nice day.
thank you